Hello, I am Sarah Hurst, a gastroenterologist here at Vanderbilt, specializing in the care of patients with inflammatory bowel disease or IBD. I'd like to thank Dr. Gannon for assisting in my ability to present remotely today so I can simultaneously give a talk this afternoon at a national GI conference in Orlando, which is where I currently am. Today, I will present my project around bringing telemedicine to the patient. We should care about telehealth as this is an expanding area and the future of medicine is innovative and patients are very interested. The UMC in particular is positioned well as we could get ahead of the competition in the surrounding area, but particularly in IBD, we're behind other medical institutions that are using this for their IBD patients such as Cleveland Clinic and University of Michigan, to name a few. This also has economic logic as it's harder and harder to get patients to battle traffic to get onto campus to see us, but we could keep return patients and thus increase return visits. This is important for patients with chronic disease such as inflammatory bowel disease to continue to see us, as they'll have significant generation of continued downstream revenue for things like radiology, surgery, and biologic medications given by our specialty pharmacy. Limitations for telehealth include the requirement for the patient still to be in a brick-and-mortar healthcare facility. Also, only certain commercial insurances cover this, not Medicare. We do need technology to support this. With Epic now available, this is feasible and actually easy to maneuver for tech-savvy patients. This is where patients with a chronic disease like IBD become a differentiator. They are younger, mostly have commercial insurance that would cover telehealth, and are tech savvy, with over 90% of our patients using My Health at Vanderbilt already. The best is they are often already in a brick and mortar facility, as many patients are on infusion biologic medications, which require them to be in an infusion center every 4 to 8 weeks. We can bring telehealth to them. In order to do this, we are starting a pilot program that will involve our patients currently going to the infusion center at 100 Oaks. So far, we have all practitioners in the IBD Center on board, and patients will use the Epic telehealth platform easily through the My Health at Vanderbilt app on their electronic device. The telehealth team here at Vanderbilt has been very helpful, led by Dr. Griffith, in navigating through the process thus far and making sure all needed partners are on board. If this is successful, we will plan to push to other infusion centers in the area, including infusion centers as far away as Knoxville and Chattanooga. We hope to have the pilot up and running within 6 months and the expansion ready within 24 months. But we still need and will need to expand. We are currently working through scheduling template building, which takes up to 6 to 8 weeks. We also need to make sure our providers have appropriate IT equipment. We are working through some smaller things like note templates for telehealth visits and billing. The bigger long-term barriers will be to make sure that we have continued IT support to improve access to this on a larger scale to patients and practitioners. Also, VUMC must provide adequate scheduling support in the form of flexibility in our own schedules, as well as adequate PSR staffing. We also must have support for partnerships outside the institution in the form of these outside infusion centers. Eventually, improved marketing to allow us to expand above the competition in the area will be useful as well. Thank you very much, and I'm happy to answer any questions.